Hello, welcome back. I'm Dr. Mark. Today we're going to talk about vital signs. Of course, vital signs are a very important parameter that tell us very quickly the health state of a patient and if his or her life are in risk. And if we have to take immediate action to save the patient's life. Previously mentioned, vital signs are measurements that tell us very quickly how's the health state of a patient and if their life is in risk. There are a lot of vital signs, so I will focus only on the 5 most common vital signs, but things like pain, like the Glasgow Coma Scale and some other scales can also be considered like vital signs. So don't think that these 5, although they are the most important, they are not the only one. So let's start with the heart, of course, a vital organ, and it can tell us very quickly if something's very wrong with our patient's body. We're going to take the heart rate through the pulse, so we are going to put our fingers on top of the arteries of our patients. One of the most frequent sites that we even see in movies is, of course, the carotid artery in the neck. So we'll basically put our fingers near this artery on the neck of the patient, and we're going to count how many times it beats in 1 minute. We can also use the temporal artery, the brachial artery, or the radial artery. Radial artery is also very common place to measure it, and it's just by the wrist. So on the left or on the exterior side of the wrist, we can also check this heartbeat. There are some other sites less commonly used, like the femoral artery, popliteal artery, and some in the feet. These pulses that we can feel may also indicate us approximately how is the blood pressure, that we are going to talk about it in a minute, but we basically use it for heart rate, so it's the most frequent one. Of course, depending on the frequency or on the number of beats we get per minute, we can be normal when we have from 50 to 100. We can have a slow heart rate, so the heart is working slower than normal. This is called bradycardia. And less than 50 is just bradycardia. It's not always a disease. Some athletes have very efficient hearts, very properly trained hearts, and so they may have normal bradycardia. However, a normal patient should be between 50 and 100, and when we have an elderly patient or a fragile patient with less than 50, that's a heart that is really going, it's really not doing its job. And we may also find a very fast working heart, a very fast heart rate, and this is called tachycardia. Tachycardia is, of course, over 100 beats per minute, and it's a heart that is trying to fight something, and that may result in exhaustion, and of course a heart that has a dysfunction. Then we see blood pressure. Blood pressure is, of course, divided in 2 main components. So we put a kind of a band, it's called a cuff, and this cuff will allow us to block the passage of blood, and of course we release it very slowly until the blood overcomes the pressure of the cuff, and that's the way we measure blood pressure. There are 2 measurements. The first time the heart manages to overcome the cuff, and then the last time that we can hear that blood overcoming the cuff. This is the high one is called systolic blood pressure, and the low one is called diastolic blood pressure. And as I was mentioning, the high blood pressure, the systolic blood pressure, is often considered as the strength the heart has to push the blood to the rest of the body. The lower, the diastolic blood pressure, is considered the strength in the blood vessel. So how hard or how strong are my arteries? When we are talking about normal pressure, we should find between 90 and 120 millimeters of mercury. This is, of course, talking about the systolic blood pressure, and talking about the diastolic blood pressure is between 60 and 80. When we have lower pressures than this, so under 90 and under 60, 90 for systolic and 60 for diastolic, we're talking about hypotension. There are a lot of causes, but it basically means that blood doesn't have enough pressure to reach the brain and the rest of the tissues. This can lead to low oxygen levels in the tissue, and of course later on an infarction. And I may also have hypertension. This is considered over 130 millimeters of mercury. This is very risky because it may lead to significant damage of my arteries, and even if it's too high, the breakage and the destruction of my arteries and the spillage of blood everywhere. And the diastolic blood pressure should never be over 80. You may also notice that there is a gap between the maximum normal blood pressure, talking about systolic blood pressure, and hypertension. What is between 120 and 130? Of course, this is already altered, so it's not a normal state of blood pressure, but it's not yet considered hypertension. So it's a bit of a hybrid, but basically a patient that has over 120 should be checked, and we should start to protect that patient from reaching hypertension. That, of course, that patient is at risk. Then we have respiratory rate. This tells us how fast our lungs are, of course, working. This may increase when we are fighting something, once again, because we want to make sure that when we are fighting something, we have enough oxygen in our body. We are going to basically measure this respiratory rate very easily. We are going to watch the lungs get filled with oxygen or with air and then get emptied. The easiest way, once again, is looking at the abdomen. If it's not very apparent, if we can't just know when the patient is breathing, we may put our hand on the patient's abdomen or on the patient's thorax, and that shows us that he or she is breathing. Another technique, we can put a mirror over or next to the patient's mouth and watch the patient breathe basically on the mirror and count. We're going to count, once again, 1 minute of breaths, and that is going to tell us the respiratory rate. We can also, if it's of course an emergency, count for 5 seconds or 10 seconds and multiply the number that we get to get the complete minute. For example, if I have a patient that took 2 breaths in 10 seconds, that number 2, I am going to multiply it for 6, so I will get 12 breaths per minute. What's the normal amount? What's the normal respiratory rate? Between 12 and 20. That's a normal patient that is completely fine and without any disease. If I have less than 12 breaths per minute, that's bradypnea, so a lung that is basically breathing too slow. And if I have over 20, I have tachypnea. That is a lung that is making everything possible to increase the amount of air it gets in. And this also tells me that the lung of the patient might basically dysfunction, might get tired, and a patient is very, very critical. Along with respiratory rate, of course, what we want through respiration is to fill our blood with oxygen, and that oxygen to reach our brain, our muscles, and all of the other tissues. So we are going to measure the oxygenation, the saturation of oxygen in our blood through this device. This was very popular during the pandemic. Among health professionals, it has always been popular, but in the rest of the public, it really became famous. This is a pulse oximeter. This is going to tell us our pulse, so our heart rate. So we can see that this patient is perfectly normal because it has 86 beats per minute. And it will also tell us the amount or the percentage of our blood to be filled with oxygen. And the normal level is, of course, to be over 94. So from 94 to 100, that is basically a normal patient. This can be different according to the patient's age, altitude, and some other parameters, but in general, from 94 to 100, that is a perfectly normal patient. A patient that has under 94 is a patient that has hypoxia, so low oxygen levels in his or her blood. Once again, there is some very few cases where external circumstances can lead to a patient having under 94 and still be normal. But in general, a patient less than 94 should check with his or her physician as soon as possible and basically evaluate that lung function. And finally, we are going to take a look at temperature. We, of course, measure temperature because it's a sign, a very early sign of infection and other types of diseases. We are going to measure it through a thermometer, and that thermometer can be put in several areas of the body. So we have the axillary temperature, we can put it in the mouth, in the ears. In babies and in patients that are difficult to measure, we can put it transrectal, and it will give also a very good measurement. Once again, with the pandemic, now we even have like these little laser guns that can measure very fast and very accurate our body temperature. The normal body temperature is between 35 and 37. About the metric system, if we want Fahrenheit for our American friends, that would be equivalent to 98.6. Hypothermia, so a low temperature for the body, is less than 35 degrees. Once again, Fahrenheit is under 95, and fever is over 38 degrees, Fahrenheit over 100.4 degrees. This is it for today's video. Remember that the guide is already up in our online store. The link is in the description of this video. Check it out. Thanks for watching this video, and as always, help us change the world. Share the information.